Imagine waking up one day with fatigue so intense it feels like you're carrying weights on your body. Your joints ache, your heart races, and your brain feels foggy, but doctors keep telling you it's all in your head. Could it be Lyme disease? And more importantly, if it is, can you fight back? Welcome to Levitas. What is Lyme disease? Lyme disease is a bacterial infection caused by Borrelia burgdorferi and is transmitted through the bite of infected black-legged ticks, or deer ticks. These tiny parasites latch onto the skin, feeding on blood while injecting bacteria into the bloodstream. Once inside the body, Borrelia burgdorferi spreads rapidly, affecting the skin, joints, nervous system, and even the heart. Unlike other infections, Lyme disease is stealthy, disguising itself within tissues and evading the immune system, making it difficult to detect and eliminate. Ticks carrying Lyme disease thrive in wooded areas, tall grass, and humid environments. A bite often goes unnoticed because ticks secrete an anesthetic, numbing the area while feeding. Not everyone who gets bitten will develop Lyme disease, but those who do may face severe, long-lasting complications if left untreated. The scary problem is symptoms don't always appear right away, and when they do, they can easily be mistaken for the flu or other common illnesses. That's why knowing the early warning signs is critical. What are the early symptoms? The first symptoms of Lyme disease typically appear within 3 to 30 days after a tick bite. One of the earliest and most recognizable signs is the bullseye rash, also known as erythema migrans, a circular red rash that gradually expands outward. However, not everyone develops this rash, making diagnosis even trickier. Other early symptoms include fever, chills, muscle aches, headaches, and fatigue, which can easily mimic a common viral infection. These occur as the immune system detects and fights the bacterial invasion, triggering inflammation and releasing cytokines that cause fever and body pain. During this early stage, or the localized infection phase, the bacteria are still near the bite site but can quickly spread through the bloodstream if untreated. The issue is many people ignore these symptoms or mistake them for a mild illness, allowing Lyme disease to progress to its more dangerous stages. At this point, early treatment with antibiotics can stop the infection completely. But if the bacteria aren't eliminated, they travel deeper into the body, leading to chronic complications that can last months or even years. What are the later symptoms? If left untreated, Lyme disease enters the disseminated stage, where bacteria spread to the joints, nervous system, and organs. This stage can occur weeks, months, or even years after infection. One of the most common later symptoms is Lyme arthritis, where bacteria trigger chronic inflammation in the joints, causing swelling, stiffness, and intense pain, particularly in the knees and larger joints. The disease can also attack the nervous system, leading to neurological symptoms like numbness, tingling, memory loss, confusion, and Bell's palsy or facial paralysis. This happens because Borrelia burgdorferi disrupts the protective sheath around nerves, causing misfiring signals and neurological dysfunction. In severe cases, Lyme bacteria can invade the heart, leading to Lyme carditis, which causes irregular heartbeats, dizziness, and even heart failure. These long-term complications make Lyme disease one of the most underestimated infections, turning what could have been a simple antibiotic treatment into a lifelong battle with chronic illness. What are the greater risks of this disease? The real danger of Lyme disease isn't just the infection itself. It's the long-term consequences if it's misdiagnosed or left untreated. One major risk is chronic Lyme disease, also known as post-treatment Lyme disease syndrome. Even after antibiotic treatment, some people experience persistent symptoms like fatigue, pain, and cognitive issues for months or even years. Scientists believe this may be due to residual bacterial fragments or an autoimmune response triggered by the infection. Another serious risk is neurological damage. Lyme disease can lead to neuroborreliosis, a condition where bacteria infect the brain and spinal cord, causing seizures, mood disorders, and cognitive decline. Heart complications are another silent but deadly threat. Lyme carditis can cause sudden heart failure, especially if the infection interrupts electrical signals in the heart. Some studies even suggest a link between Lyme disease and autoimmune diseases, where the immune system starts attacking the body's own tissues long after the bacteria are gone. The biggest risk? Misdiagnosis. Lyme disease is often mistaken for fibromyalgia, chronic fatigue syndrome, depression, or even multiple sclerosis, delaying proper treatment and allowing the infection to progress unchecked. Why is it hard to diagnose? Lyme disease is notoriously difficult to diagnose. This is because its symptoms mimic dozens of other conditions, including flu, chronic fatigue, fibromyalgia, and even autoimmune diseases. Standard blood tests look for antibodies against Borrelia burgdorferi, but here's the problem. These antibodies don't appear immediately. In the first few weeks, a test could come back negative, even if Lyme disease is present. Many doctors rely on the two-tier testing system. One is ELISA, or the enzyme-linked immunosorbent assay, a screening test that detects Lyme antibodies, and Western blot, a follow-up test confirming the presence of specific Lyme proteins. However, both tests can miss early-stage infections, leading to false negatives. That's why a clinical diagnosis based on symptoms, tick exposure, and patient history is critical. Advanced tests like PCR, also known as polymerase chain reaction, can detect Lyme DNA in blood, spinal fluid, or joint fluid, offering higher accuracy. Early detection is key. The sooner Lyme disease is diagnosed, the easier it is to treat before severe complications arise. Is Lyme disease 100% curable? Yes, Lyme disease is curable if treated early. In the first few weeks, a 2 to 4 week course of antibiotics like doxycycline, amoxicillin, or cefuroxime is usually highly effective. However, if treatment is delayed, the bacteria spread deeper into the body, making it much harder to eliminate. Some patients develop post-treatment Lyme disease syndrome, where symptoms persist even after antibiotics. This may be due to immune system overactivation or bacterial remnants triggering inflammation. For chronic cases, combination antibiotic therapies, anti-inflammatory treatments, and immune support strategies are often used. Can it affect oral health? Yes, Lyme disease can impact oral health in several ways, including jaw and facial pain, since Lyme bacteria affect nerves, leading to chronic jaw stiffness, TMJ dysfunction, and facial muscle spasms. Tooth sensitivity and pain, because Borrelia burgdorferi can trigger nerve inflammation, making teeth feel painful, even without cavities. Dry mouth and gum disease. This is because Lyme affects salivary glands, reducing saliva production and increasing gum infections and tooth decay. Poor oral health can worsen overall inflammation, making Lyme disease even harder to manage. Maintaining good oral hygiene, staying hydrated, and working with a dentist familiar with Lyme-related issues is essential for preventing complications. In conclusion, Lyme disease is far more than just a tick bite. It's a complex, stealthy infection that can infiltrate the joints, nervous system, and even the heart if left untreated. Its early symptoms often mimic common illnesses, causing delays in diagnosis and giving the bacteria time to spread deeper into the body. The bullseye rash, though a key indicator, doesn't appear in all cases, making clinical awareness crucial. As the infection progresses, it can lead to severe neurological disorders, chronic joint inflammation, and even life-threatening heart complications. The greatest risk is a misdiagnosis. Many patients are told they have fibromyalgia, chronic fatigue, or anxiety, allowing the infection to worsen. Proper testing, including PCR and Western blot, is essential for early detection. Although early-stage Lyme disease is highly treatable with antibiotics, delayed treatment can lead to persistent symptoms known as the post-treatment Lyme disease syndrome. Even oral health isn't spared. Nerve damage, jaw pain, and gum disease are common complications. With its ability to disguise itself and evade detection, Lyme disease remains one of the most misunderstood infections, underscoring the urgent need for awareness, early detection, and timely treatment. Thank you for tuning in to Levitas. Please share today's video with friends and family, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So stay healthy, stay happy, and keep going.